Hi, this is Susan with Aspen Senior Care, and I have Treasa Wilkinson here with me as well. We are going to be talking about bathing, incontinence care, and other useful tips for our senior clients. And so we'll start out with incontinence care. I feel like the most important thing is to make sure that the tools you need to care for someone with incontinence are available to you in the home. So if you need to talk to family members, leave a little note for them that you need some barrier cream, washable bed pads, briefs that will contain their output, and or large pads that will fit inside of the brief. The reason for the washable bed pads is that if they are saturating their bed every night, then you are having to strip the whole bed and wash everything and put it all back on, where you may just need to wash a bed pad. And so that's much better. And so those are all pretty self-explanatory. When a caregiver first comes into the home and they are dealing with a client that has incontinence, the very first thing would be to check their brief. If they've been laying in a soggy brief all night or for several hours, that's going to cause more skin breakdown quicker. And so you want to get that wet brief off, get them into the shower, and get them cleaned up. And as you proceed to do that, it's nice to just say, hey, let's go into the shower or let's go into the bathroom and get a nice fresh brief on you so that you feel fresh and clean. And turn on the shower, help them, undress, get into the shower so that you can get them cleaned up for the day. And, actually, and then when we're bathing a client, if your client is in pain, if they have chronic pain, or if you know they have a leg that really bothers them or their shoulders or whatever, you want to deal with that pain first so that we can make that bathing experience as positive and as pleasurable as we can for them. And so ask them, how is your shoulder feeling? Or when did you have medication last? Or whatever you need to do to find out where they're at pain-wise. If they are hurting, then, and you are able to give them pain medication, give them that medication about 30 minutes prior to their bath so it has time to start working. A lot of signs of pain, if they can't verbalize it and have, if they won't say, I'm really hurting. A lot of times the signs of pain will show up as just being irritable or frustrated, angry, or they may not want to eat their breakfast. They're just hurting. And so if they normally eat their breakfast before their bath and they're not eating it, that's a telltale sign. They may be tearful. They may be, just easy to cry. Or they may have a temperature. They may be sick. And so those are things that you can look for to tell if they are in pain. So now that they are comfortable and ready for their bath, the first thing you want to do at that point would be to prepare all of your supplies. Make sure you have their clothing, their underclothing, their powders, their lotions, their deodorant, whatever it is that they use through their bath time. You want to have it right there where you can reach it easy so that you don't need to leave your client alone. And then make sure that you are not in a hurry, that they do not feel rushed. that they can see that you're calm and relaxed and ready to just have this be a delightful experience, honestly. So in setting that stage for a successful experience, find out when they like to have their bath, what their grooming habits are. If they have their bath at night, when they first wake up in the morning, after breakfast, whenever. And the more we can keep to their regular routine, the better for them. Seniors get cold, and so it's really helpful to make sure that bathroom is warm. If it means a little space heater that the family can provide for you to warm up the bathroom, or to get the hot water going and getting a little steamy in there, as long as you're not going to run out of hot water. I've had that happen. And so, and then to make sure you have plenty of towels. The great thing about us being in the home for more than just a quick bath is that we are there so that we can take time to wash the bath towels and things that we've been using and get them dried and possibly put away before we leave. Or if there's another shift, then they can finish that. Can't think of the word. Process. And so anyway, let's see. Let's finish talking about towels here for just a minute. We not only want to have them there to keep them warm, but we want towels to help us to keep them safe, so they're not going to slide or slip on the shower or tub floor, and to help keep them feeling modest and that they have their dignity. And so we always want to be able to have a towel to put around their shoulders, across their lap, one to put their feet on the floor, so you know they're going to not slip, and it's even a little warmer to start out. Possibly a towel for them to sit on instead of that hard, cold plastic. Maybe a towel behind their back. So we're talking lots of towels, but not to worry, because we have the time to get those washed and ready to use again. When we are bathing a client, we want to have good communication. If we're talking really fast, if we're not looking at them, if we're moving around the bathroom, trying to let them know what we're going to do, for one thing, that's going to probably cause them some anxiety and not make them feel comfortable and like you are calm and ready to go. So we always want to use a soft, clear voice and speak slowly so they can understand you. And explain what you're going to do. You know, here, let's sit you down and we'll, you know, here's the shower hose for you to hold on yourself so you can stay warm. We'll wash your face first. And as you're bathing a client, this is a wonderful time to check their skin as you go down their body for skin breakdown, for bruises, for skin tears, for redness. You know, that's the beginning of some skin breakdown, is just a red spot. And so that we know what we need to do to prevent it from getting worse.
Thanks, Susan. I'm going to just touch a little bit about promoting independence. I think this is a very important part of our job, not only in bathing and showering our clients, but also in almost every area that we help our clients with. It's important that they still feel like they have that independence and that they are able to make some choices for themselves and able to take care of themselves with what they can do. As far as bathing goes, though, it's always best to start with the cleanest part of their body and work your way down to the dirtiest. So in this case, we would start with the hair and the face, work our way down to the chest and arms and so on and so forth. If we have a client that needs help with brushing their teeth, it's very important that we use hand over hand method. And you always should stand on the side that they are dominant on. So if they're right-handed, then you stand on their right side. Same with brushing the hair. And if you have a female client who likes to wear lipstick, see if she can do her lipstick by herself. If she needs a little bit of help, use that hand over hand method. And then give those choices like we talked about a little bit ago. Remember to dry thoroughly after showering and bathing. This is very important. Make sure you do it gently and not rough like sandpaper. Get those folds and those creases. This is where moisture gets trapped and can't dry out on their own, and then the skin can break down and they can get sores and redness there. Apply the powders if they like the powder. Offer lotion. Many clients like to have a little hand massage, back massage, feet, legs, wherever they enjoy that lotion. And then of course, put the deodorant on. It's good that they still keep up their good personal hygiene. This is also, I feel like, a good time to use that barrier cream if they have any sore areas. One barrier cream that I also really like is, I'm gonna slaughter the name, Susan, maybe you can help me. It's Calmoseptine, I think is how it's pronounced. That was one of my favorite barrier creams that I used often.
And it is spelled, if you want to take notes, Calmoseptine. And you can get it at any one of your local drugstores. Okay. Working with a client with dementia and needing to bathe them, you're still going to want to use the same kind of towels, keep them covered, and make them feel like they have their dignity, and so on and so forth. What you do want to do a little different is possibly get down, squat down, kneel down in front of them so they can see your face, and a happy face, and let them know that you're gonna help them get nice and clean and feel good for the day. There again, use your clear, soft voice. Tell them step by step what you're going to be doing, or give them instructions step by step. If they can do a lot for themselves, say, here's a nice warm wet washcloth. Here's some soap for you to put on. You can just use really simple 2-word cues so that they can remember what they need to do. You don't want to just tell them about their whole body all at once. You want to just give them slow step-by-step instructions. Another really nice thing for those with dementia is in making this as a pleasant experience as possible is to kind of give them any type of distraction. So they may have some favorite songs you're aware of that you could sing in the bathroom, or just the ones you know from when you're a kid, row, row, row your boat, or, whatever. A lot of seniors really enjoy singing, especially those with dementia. They may not even be very verbal, but they can still sing. Visit with them, ask them about when they lived in such and such a place, or about a certain vacation. Have them share stories. just things to keep their mind off of that bath that they may not have wanted to have in the beginning, but as you make the experience pleasant, then they will relax and turn it into a positive experience. So
Can I add something to that, Susan?
absolutely.
The singing, if you're not comfortable with singing, what do you think about just playing music? Maybe if they have an Alexa or on your phone.
Yes.
Some music that they enjoy, though, I think would probably be the key.
Oh, I think that's excellent. Yeah, I think that's probably even works better. So, okay.
Okay, let's talk a little bit about bed baths. It's always useful to use a draw sheet when you have a client who needs a bed bath. This will help you be able to assist rolling them from side to side. If they are in a hospital bed, it's helpful, and if they are able to, once they are on their side, if they can hold on to the railing so they don't slowly roll back onto their back. Otherwise, sometimes if they are not able to hold themselves on their side, it may be a two-person job for a bed bath. So if somebody else is in the home, a spouse, a child, whoever, that may be helpful.
Can I add to that?
Sure.
Just in thinking about my past experiences, hospital beds are narrow, but if you're able to position your client in the middle of the bed, if they don't have a rail to hold on to, put a pillow in front of them that they can hold.
That's a good idea.
So they have something that is close to them that they can hold on to, but yet they're still in the middle of the bed. So feel secure that they're going to be okay, and that might make them feel more secure as well.
I think that's a great idea. Thanks. The next bullet point is using pink hospital tubs for soapy water and rinse water. So you would need two tubs, one for the soapy water, and then you would rinse the washcloth out after you have washed their body or that specific body part in the rinse water. Now, this was, I feel like this was done, years and years ago. Now they have these awesome bath wipes that are heaven sent. They're easy. And if you can warm them up in the microwave for, 30 seconds, it just makes it much more pleasurable and comfortable for the client not to have a cold, wet wipe going across their body. Another useful tip using those bath wipes is to use one wipe per body area. So maybe start with the eyes, get the gunky stuff out of their eyes, and then fold it over, finish the face, and move down to the neck, and then switch it out to do their chest, the underarms, the arms. Anyway, you get the idea.
And don't forget their ears.
Oh, yes. The ears are very important, inside and behind.
Yes.
As well.
Yes.
Another good tip on the wipes or a bed bath in general is to have a hand towel close by so you can dry off that area and make sure that it gets dry so it doesn't break down as well. And again, be gentle when you're drying the skin.
Awesome. Right. All right. Our famous Teepa Snow that we all know and love, she has taught us so much about dementia care, has some great tips for brushing someone's teeth. And Treasa mentioned earlier that when you're helping someone, you want to be on their dominant side. So if they're right-handed, you'd be on their right side, left on their left side. And then brushing their teeth, put the toothbrush in their hand, but maybe put your hand over theirs so you're in control of the motion, but because their hand is holding on to the toothbrush, for some reason, their brain thinks they're doing the brushing themselves. And so they feel like they are, independent in that, even though they may need a little help. Another great tip was that as you are helping them brush their teeth, comb their hair, whatever, to put your hand on that dominant side. So if you're helping them with your right hand, if they're right-handed, put your left hand up on their shoulder and apply some gentle downward pressure while they're brushing. And so to feel that warmth and that gentle pressure on their shoulder is soothing, and it takes away from the attention of what's really happening with brushing their teeth. And so there again, it just makes for a more relaxed, positive experience.
All right, other useful tips. You guys came in with a bunch of useful tips and they were so appreciated. These are wonderful things to consider. Bathing safety. It's important to have a non-skid bath rug. This helps, obviously, helps from falls and slipping. A towel on the shower chair can help with the coldness of that hard plastic, as well as a towel on the shower floor will help with the sliding. As a rubberized bath mat is also good. A shower chair in the shower is very helpful, especially if your client is a fall risk or even if they're just a little bit wobbly. Handrails are also good. Shower hose, I found that if you let them hold the shower hose and kind of run it across their body, that is super helpful. Independence in bathing. Stay in the bathroom if at all possible. It's easier to check on them. I know some clients don't particularly like somebody in the bathroom with them, but maybe if you kind of put a spin on it about saying that you need to clean up the bathroom a little bit while they're showering, I think that is a brilliant suggestion that came in. That way, if something does seem to not be going right, you're right there with them and they won't be alone and an emergency situation won't happen. So I don't know, Susan, do you have anything else? Oh, clean up or avoid the clutter. That was the other thing. Clutter in the bathroom.
Yeah, so those are excellent tips. Thanks, Treasa. I guess in closing, I would just like to say that, as a caregiver, we need to put ourselves in their shoes and think about how we would feel if somebody had to do those things for us. We need to be their cheerleaders and root for them and let them know that they can do it. And if we have a happy smile and a positive attitude and let them know they're doing great, show them love, not judge the fact that they can't do everything for themselves, or be impatient with them, is so helpful. And it helps to build that relationship that, what do you call it?
Camaraderie?
Yeah,
I don't know.
with each other. And so, this is not their choice. They wouldn't ask to spend their later years of life needing to have this kind of help. And so the more you can just make it fun, divert their attention, make it positive and feel good, the more apt they are to respond in a positive fashion. And so hope that those things help, especially our newer caregivers that may not have had a lot of experience with giving baths. But thanks so much. And if you ever have any questions, please don't hesitate to call us. Call the main office number. and they can get us. Thanks.
Thank you.